Good morning. Altogether Better is a transformational, innovative programme in Sunderland to transform the quality of life and the outcomes for our residents and people who use services in Sunderland. We know that there are avoidable admissions into hospital that with the right earlier intervention in community services can be avoided and transform people's quality of life, and we also know the same applies to avoidable long-term admissions into care homes and residential homes. And alongside that, there are huge financial pressures facing the NHS and care services that are frankly unsustainable at the moment. Altogether Better transforms those challenges and those opportunities. By our organisations and our teams and our frontline staff working differently together, we can transform those opportunities and help people to avoid emergency admissions and to move out of hospital much more quickly than would have been the case otherwise. We have three key programmes to help deliver that transformation: recovery at home, community integrated teams and enhanced primary care at scale. And we're going to start by looking at recovery at home.
Recovery at home service is made up of a whole range of different elements. It has nursing teams, intermediate care and urgent care teams. It has social workers, it has social care staff, pharmacists, out of hours GPs and advanced practitioners from the ambulance service. All of those people come together as one single service, and the idea is that we triage people coming through to the service and ensure that we provide an appropriate response to their individual needs. Prior to the recovery at home service coming together, patients would have had a whole range of different type of responses to their needs. So it would have been a health response separate to a social care response. This way, through one integrated single service, we're able to provide services to people that actually helps them at that time of crisis, or when they need to be supported to come home from hospital, or actually to prevent them from going into hospital. The difference that the service is making to people is that it's very person-centred. It means that they're not having a whole range of handoffs between the different professionals. We're able to provide that unique point of access 24/7, and it also ensures is that we have an integrated approach to that person and to make sure that we can meet their full needs rather than just being a health model or a social care model. It is an integrated model that provides that single response.
We're just part of the Recovery at Home team, and we'll work with a multidisciplinary team including pharmacists, social workers, carers, many different people that we all work in one team to try and provide an all-round care for the patients, so they only have one point of contact, so they can contact any part of the service as opposed to having several different numbers to ring.
When the call comes in, it's allocated via the single point of contact to the appropriate service. We would go out and see patients within their own home and treat them for minor illness, injuries. We can liaise with other services if a patient needed extra care support, any equipment. We can phone back to the single point of contact, so it's only one contact that the patient has to have with ourselves. We can liaise with the other services to get the appropriate treatment and things in place for them.
We've also got 5 community integrated teams across Sunderland that wrap together services from community nurses, primary care, GP practices, social workers and voluntary partners to help support people to avoid admission into hospital and into care homes, particularly those at the highest risk and in greatest need of support.
Now that we're working as Altogether Better, we meet on a weekly basis as a team, which involves the nurses, the community matrons, carer centre, the wellness worker and social care, and the GP from the practice. This involves us discussing patients who we feel would benefit from a review to make sure that they're safe to remain at home and provide holistic care looking at the health and social needs for the patient themselves as well as their family. Since we've been working as part of this team, I've noticed that patient referrals are much quicker and we're getting much more robust information shared between each individual, which means that care is then put in place much more rapidly for patients at home, and it stops duplication of information to relatives and families, and the patient is at the core of the discussions that are held.
As well as Recovery at Home and our 5 community integrated teams, our GP Alliance is working right across Sunderland to see how across all of our GP practices in primary care we can transform services and offer those services to a much broader range of our residents and our patients.
Hi, I'm Paul Swinburne. I'm GP at Dr. Stevenson and Partners. Linda registered with the practice. She'd had quite a lot of input from a previous practice, and she came to see us to maybe get a different approach if she could. The initial consultations were just about listening and finding out what the issues were. She was quite complicated insofar as the problems that were affecting her. Essentially, she was crippled with recurrent bouts of abdominal pain, and she was finding these very difficult to cope with. The severity of the attacks were compelling her to seek help from agencies such as 111, heavily relying on the A&E department at Gateshead. So, we had to have a think about how we could help her best with those problems. One of the first things that we did was to see what it was that she wanted to happen, and I did ask her, if we could manage this at home for you, so that you didn't have to go to hospital. Would that change, your situation for the better? Would it enable you to get on, with your life more? And she said that she would find that, very useful to train her and her husband up to be able to give the injections at home, so that she wouldn't need to go into hospital for those treatments. Because of the complexity of her case, it was felt that it would be a really good idea to try and adopt a multidisciplinary approach, and this coincided sort of nicely with the advent of the community integrated teams to sort of try and devise a plan which would enable her to be managed at home but would also keep her safe. Once we just sort of agreed on a basic framework for that plan, it was just a case of putting it into place, working with the nurses to ensure that Linda and her husband were adequately trained in how to give the injections. I think in Linda's case in particular, there's been a dramatic reduction in her reliance on hospital, and more importantly herself. She feels that her quality of life has been transformed by something as simple as being able to give herself the treatment at home, to the extent where she's now able to take little holidays where she wasn't able to do that before.
In the past, due to the structure of the NHS and its landscape, professionals and services were very fragmented. We all worked in silos. Communication wasn't really very good. Patients felt that they had to repeat the story several times. They were managed and treated as several conditions. And that's been historical, that's been ongoing for a long time. For example, doctors, community nurses, social workers, it was very difficult to get them together to communicate. With Altogether Better, what we've done is we've thought, what are the gaps in the service? What are the patients telling us that they need and that we're not able to deliver? So what are the needs that we are not meeting? And we've identified a few areas that we have to focus on. One of the biggest areas is bringing people together, looking at the patient as a whole, as a person, rather than a series or a group of medical problems, which meant that we had to bring all these professionals together. Wrap them around the patients. We're talking about the more complex patients with very high social and medical needs. So we're wrapping groups of people like doctors, the nurses, social workers, community psychiatry nurses around these patients. We are wrapping them virtually and physically. Physically as in co-locating them. So we're bringing these people, these teams together in one place, and virtually by sharing information. So the patients don't have to repeat the story several times. So we've got sharing information on systems at the moment. So for example, the type of patient that we would be looking at or targeting is one of my patients. She's 91 years old, she's got COPD, she's got heart disease, she's diabetic, she's very frail and old and got arthritis and struggles to mobilize and needs a lot of support at home. Unfortunately, because of her problems, she ends up having a lot of medical crises, where she ends up in hospital when it could have been managed at home if she had more support. So we are having meetings to discuss what are her needs, what are the potential problems she might face, and putting things in place to address them. So we've had a meeting last week with a social worker, with the community matron and myself, and we went out to see my patient, and we made a plan together. What happens if she becomes unwell, what happens if she has a chest infection, a water infection, do we increase her social care package, and she knows who to contact if she does feel she's becoming unwell, rather than wait too long, then it becomes a crisis. So the patients now with Altogether Better Sunderland would expect a more cohesive joined-up service, that the professionals or people looking after them, whether health or social care, would be working together. Patients would have a person or professional they would go to for their care. They would have a plan in place that they would be working with those professionals to develop. We would be looking to support the carers, the family, and the patient to respect their wishes and usually look after them at the right place. Patients, from what we've heard from them in the past, is that they feel that they're not always looked after at the right place, and usually they end up in hospital when they would rather be looked after at home.
We're at the very start of a fantastic transformation in Sunderland. We're absolutely convinced that if all of our staff right across Sunderland work together, we can transform outcomes and help people avoid those admissions to hospital, to help people avoid going into care homes, and to help people live the best quality of life they can in their own homes.